Hi, I'm Simon Greenwood, a clinical vascular scientist originally from the UK, currently working in Calgary, Canada, with this week's medical notepad. And today we're going to talk about what you can expect when your doctor orders a vascular ultrasound.
A patient would typically arrive at the reception area, have a seat in the waiting room, and get called through for their ultrasound exam. And when they enter the room, they'll be greeted by the sonographer performing the test. There's a separate changing cubicle in each room for the patient. Depending on what test is being performed, you may be asked to change into a pair of shorts. Once the patient is changed into the appropriate attire, the patient will then be asked to lie down on the ultrasound bed. And the technologist performing the scan will explain the procedure, where they're going to be looking, what they're going to be looking at, and what happens with the patient's results following the exam. And for a leg arterial ultrasound scan, we start at the groin for each patient, and then we basically follow the leg down to the ankle. We're going to be applying some jelly, and we're going to be taking pictures at multiple levels, basically to ensure that we're imaging all of the blood vessels as we need to, and making the most appropriate diagnosis. The majority of our tests are actually performed on the legs, and it's for patients who've got pain when they're walking, numbness, tingling, cold sensation in their legs, or non-healing wounds. So we perform an ultrasound scan looking directly at the blood vessels in real time to assess for any narrowings or any blockages. And our vascular interventional radiologists will do a really detailed written report.
With this week's medical notepad, I'm Simon Greenwood.
Medical Notepad is a series for educational and informational purposes only. Advice offered is not a substitute for medical advice from your own supervising physician. Do not act on any information provided in this series without the explicit consent from your own healthcare team. For more information on peripheral artery disease, go to standagainsamputation.com, and for peripheral artery disease support, go to thewaytomyheart.org.